Hello everyone, I'm Dr. Deepanshi and I'm back with a case study, and this will be a gynecological case that we'll see, and we will see the what are the pros and the cons, and we will see how we will manage this case, and many other things we will know. So kindly please like, share and subscribe if you get to learn things from this video. So let's dive into the case. Let's go. So it's a case, as you can see, it's a case of a Boston Terrier which is 18-month-old and was bred 65 days ago. It's a female. Breeding was done 65 days ago. Temperature is 99 degree Fahrenheit, has clear vaginal discharge, having intermittent contraction for 6 hours. As we said, it was bred 65 days ago, and as we know, the pregnancy period for canines are 65 days plus or minus 2 days. And the owner is concerned. Temperature is also lower, 99 Fahrenheit. And this we should remember, as the animal is going towards the parturition, the temperature will get lowered. And the owner is concerned. So by seeing this, what can be your diagnosis? Like, what intermittent contraction are going for 6 hours? What is your diagnosis? I think you all have got it. It's a case of dystocia. Okay. So now we will dive into 5 major questions which we came across if we go or see a case of dystocia. If we go and manage a case of dystocia, or we see a case of dystocia. So let's go. It's a case of dystocia. First, we should know what are the breeds in which dystocia is very common. We should always remember the smaller dogs. Breeds with have large head and wide shoulders, such as bulldog, pug and terriers also you saw. These are the majority of the dogs in which we can see dystocia. Dystocia is very common in these kind of dogs. Now moving on to the next question, which is what problem should be ruled out before attempting the medical therapy to stimulate the uterine contraction. For stimulating uterine contraction, often we just think of oxytocin, like, yeah, we should go and give oxytocin and everything will be fine. No, we should first see abdominal radiograph and also do the proper vaginal examination. Oxytocin should never be given. It will not give a fruitful effect if there is no cervical dilatation. Cervical dilatation will happen, then only the fetus will come out, right? So cervical dilatation is an indication that now the fetus is ready to come out. So insufficient cervical dilatation, that we will judge by vaginal examination. Any vaginal stricture is there, any mass, any tumor growth is there, or vaginal torsion uterine torsion has occurred, or it's a case of inguinal hernia. From the mother side, there can be maternal pelvis abnormalities, fetal malpositions, which we can see through radiograph. And if it's an oversized fetus, mostly in case of single fetus syndrome, we will get these cases, like the fetus size will be very big, or also the overcrowding. If the number of fetus are many more, then also we can see a case of dystocia. Now moving on to the next one, how to determine fetal viability, whether we should use a USG or we should do a radiograph. In my opinion, I'll say the USG is the best method. We can see the fetal viability properly. We can also assess the fetal movements. And some people now ask me, why not radiograph? Why we should not take radiograph? In radiograph, we can see 3 most important thing that we can see in radiograph. That is, if the fetus is dead, throughout the body you can see an intrafetal gas pattern. We always know whenever we are seeing an X-ray, in X-ray, if we are seeing 3 things are very important while reading a radiograph. If we want to detect fetal viability, 3 things that will indicate that fetal is no more. That is, we can see an intrafetal gas pattern in the fetal body itself. We can see blackish area, as I want to say. And if this is the thing in which many students get confused. The thing is, in radiology, whenever we are seeing a radiograph, if you see a black color area, that indicates air. In X-ray, that is radiograph. while if you see a black color area, in case of ultrasound it will be a fluid. Okay, so three things that are very important. First is that is intrafetal gas pattern you will see within the fetal body. Now that indicates that it will be blackish in color. Then the cranial bones will be overlapping. And the third thing, there will be a collapse of spinal column. But the most important thing, why we are not choosing radiograph as an best method against USG, because these changes will appear only after 6 to 48 hours after the fetal death. And if you want to see immediately and fastly, we want to know whether death has occurred or not, so USG is the best method to follow. Now going on to question number 4. Now we will see the indications for C-section. So now coming on to the fourth question, that is what is the indication that now we have to go for the C-section. So already we have seen the radiograph through USG. If fetal malpositions are there, fetal is oversized, overcrowding is there, and the dam or the mother is tired, very tired, and she cannot push further, and even after giving the medical therapy for more than 3 times, the animal is not able to push the fetus outside. So now it's an indication that we will go for C-section. Now with C-section, a few major questions are there, and that we will discuss now. So with C-section, the most important thing is surgery. Anyone can do surgery. They can cut open, they can stitch, that anyone can do. But the main thing is anesthetic precaution. The animal should go nicely and should come back nicely, and the fetus also, all should be alive and healthy. So what are the anesthetic precautions which should be taken for C-section, which often people forget and which comes as a loss? Either the mother dies during that procedure or the fetus, some of them dies and some of them survives, like that things will be there. So first most important thing is pregnant animals are very prone to hypox. Pregnant animals are very prone to hypoxia. So we should always have supplemental oxygen. Then we should always take correct body weight, because if body weight is not correct and we give the drugs, and overdose may lead to death. Okay, overdose of the drug may lead to death. Then long acting anesthetic agents, if we are using that can cause respiratory and cardiovascular depression of offspring, so fetus will be dead. We should not use long acting anesthetic agents. Then because of the late gastric emptying, pregnant animals are more prone to vomiting and leading to aspiration. So beforehand we should give antacids and antiemetics. A very good protocol, if we see, that will be a very nice protocol, will be for propofol. We'll just mostly suggest use propofol at the rate of 4 mg per kg in IV, and because it has 3 benefits: it has rapid onset, short duration, and very smooth recovery. This is the 3 reasons by which propofol is preferred. And I have written fluids. Fluids is very important, because as uterus is removed, as we have taken out the uterus from the body cavity to take out the fetus out, this results in redistribution of blood volume and it leads to possible hypotension for some time. So continuous fluid management is very much important. So I think you must have learned from this video some important points while handling a dystocia, and how you can take for C-section, what are the preventive measures that you can take. So if you have learned something, if you think that these kind of videos are helping you, so I'll say please like, share and subscribe my channel for more such videos, and please share so I can help more veterinary students and more vets. And by sharing the information, by sharing the education with all of us, we can create a better community and we can help a lot of animals. That should be our goal. Okay, so thanks for watching. and then meet you next time. Thank you.